Hi, welcome to QuickTalk, the MedTech Startup Podcast. I'm Axel Strombergson, Vice President at Viva MedTech. In today's episode, we're going to dive into cybersecurity, and more specifically, cybersecurity for medical devices. With me, I have Vidya Murthy, and she spent almost 2 decades in this field, and she's also the Chief Operating Officer for MedCrypt, a company who specializes in cybersecurity for medical devices. Hi, Vidya. Welcome to Quick Talk. I'm super excited to have you here today for several reasons. One reason is that I know very little about cybersecurity myself, so I'm sure I'm going to learn a lot. But before we dive in to the topic today, please give us a little bit about your background and also let us know what MedCrypt is doing and how you guys are helping medical device companies.
Awesome. Thank you, Axel. I'm super excited to chat with you today. My name is Vidya Murthy. I've been in security for 18 years, the last 10 of which have been in healthcare and medical devices in particular. And that's what drew me to MedCrypt's mission. Our mission is to enable devices that are innovative and clinically novel to get to the market safely and securely. And it matters to me personally because in my previous role, I had exposure to the fact that patients were actually declining care because they were worried about the potential for their device to be hacked. That's not a reality that we want anyone to ever face. No patient should be worrying about security when they need a medical intervention. So I'm really passionate about the space and excited to chat with you today.
No, that's great. No, thank you. Yeah, no, it's very important, right? So kind of to start off and lay the land here, talk a little bit about the current state of cybersecurity for medical devices and also a little bit about how these are integrated with the medical device regulations and FDA submissions. And lastly, sort of why should any company that has a software component be aware of this and stay on top of this as they develop their device and then bring that to the market?
Yeah, so I think when a lot of people hear healthcare cybersecurity, they immediately think hospitals or they immediately think HIPAA data breaches. And the
Right.
reality is, care has really changed in how it's delivered. If you go into a hospital now, everything is connected, right? The pump is talking to the bedside programmer, talking to the nurse's station, which talks to an electronic health record system. Everything is integrated in a way that allows care to be delivered differently than it has been in the past. And as a result of that, you now have this notion of, hey, connectivity is something we rely on to deliver care. Should we worry about the security of this connectivity? So I would say a lot of how security in medical devices has evolved has been kind of ad hoc. It started out with, hey, this would be really cool from a clinical feature perspective if we put a USB port on this thing or connected this thing via Bluetooth. And now people are realizing, well, gosh, we chose all these cool things for clinical purposes. Did we really consider the security that goes with it? So it's been a little start and go, I would say. The FDA, the main regulator here in the US for medical device security, has been putting out what they call guidances since 2014. As you can hear in the term guidance, some folks took that to mean this is optional. This isn't something that we really have to do with vigor or consistency. And in the last 2 years, I would say, there's been a really big shift post-COVID stuff calming down, the FDA being able to get back into a state where they can deal with some of these more critical infrastructure related items. And as a result, they have really built their statutory capabilities that they can enforce security expectations of device makers by stopping them from going to market or having a recall that is related to security alone.
Right. Right. No, it's interesting, like you mentioned with USB port, and it's been like a trend for a long time, like, that everything should be connected and everything should have a software component that's connected to the cloud. And of course, that means a lot of opportunity when it comes to patients and their health, but it also means opening yourself up to a lot of risk with that, of course. Also, what comes to mind is, part of this is one of the fastest growing areas when it comes to medical device industry is digital health, right? And then on top of that, it seems like also when it comes to cybersecurity, regulators are now sort of starting to catch up. So what are your thoughts on these two trends? Sort of the overlap between much more software in the medtech space, but also that increase in regulations.
Yeah, I think the latest stat I read was something like 93% of new startups in the last quarter were software as a medical device. So it's
Right.
absolutely the case, right? Like this leaning on software, leaning on data as our big differentiator. We're selling data so that people can train their AI and ML, right? Every large device manufacturer and every startup has kind of that same ethos of what novel business model can we build around data and software computation. And I think that that trend is here to stay, and it's only going to get more prevalent as care evolves. I think one of the biggest things to think about in how the regulator has matured with this is we talk about clinical innovation and how using technology has really changed how we care for patients. That's a maturity scale, right? It started with a USB port that turned into Bluetooth, that turned into something else and offered outside of the hospital. Security similarly has evolved, right? So as we think about how do we secure these things, it went from, hey, I'm going to put a plastic cover over my Ethernet port to now thinking about, okay, I need to have secure communications. I need to have secure code development practices. The regulator is similarly going through that same maturation curve. So where we have seen starting at guidance, we have now seen a great increase in enforcement. And anecdotally, I know from MedCrypt's perspective, since October 1st of 2023 through the end of last year, we saw a 700% increase in rejections of submissions due to cybersecurity alone. And that's pretty telling, right? Because I think it used to kind of be this idiosyncratic, maybe I can get through the FDA with my submission depending on my reviewer and we can talk about it. The FDA has really said, hey, systemically, we're changing how we're enforcing our security expectations. And that means you cannot pass go. You cannot start your review with us until you're able to demonstrate a certain baseline of security considerations. And that's really stopped a lot of folks from getting past the starting point.
Yeah. No, and then if you don't think about it, that can be like a significant barrier, of course, right? So it's really important. So kind of leads me to then the sort of next question and next thought about this, right? So if you're a small startup company, you're in product development and you have some sort of a software, right? Whether it's a firmware or a piece of software working with your device, or maybe it is a software as a medical device, that is the device, right? When should you start, when and how should you start including cybersecurity into product development to then set you up for that submission success and then, not get to that point where you said that you're getting rejected because you didn't think about it. So talk a little bit about that, how you can include these considerations and how into the product development process.
Yeah, so I would say step one, be intellectually honest with yourself and say, if I'm running software, I am subject to these requirements. I've seen small device manufacturers all the way to large device manufacturers try to fight the fact that these requirements actually apply. So step one, do a real honest view on what your device is planning to do and really consider whether you need to apply. To the point you raised, software, firmware, any of these attributes mean that you are subject to it. So being first honest with yourself about applicability will be the first major step. Once you kind of realize if you do fall into the category of this being applicable, I think tying your security risk into your risk management profile will be critical. What I mean by that is if there are things about how the device is being designed that you kind of have a fork in the road, right? You can choose to do something that is perhaps more aggressively secure, but ruins your cost of goods sold to the point that you can't get to market. Or you can say, hey, we're not going to take the security posture now and we'll consider it later. There are impacts to that from how you architect the rest of your device. So being intentional about initial architecture decisions, making the choice to invest early can often result in better security over the lifetime of your device. And more than that, I think the pre-commercial requirements are quite explicitly laid out in the FDA pre-market guidance, and they really state kind of what they need to see in the device before they're willing to let it go to market. So integrating those requirements both into your product lifecycle development as well as into your quality management system, I think will really position your devices to have long-going security and be postured so that they can sustain any sort of vulnerability they may face.
Right. No, that makes a lot of sense to bake it into risk management or risk assessment because that is the risk, right? Cybersecurity. But basically, I would then assume that whatever you do that to mitigate that risk, something would end up in your design history file, and that documentation would then be used as evidence to the FDA that you have considered cybersecurity. What type of outputs would FDA look for in terms of the work that you have done to mitigate the cybersecurity risk?
Yeah, exactly, right. So it's not like a device is going to be sent to the FDA, and then they're going to do their own security testing on it. They need to see evidence of consideration through your quality management system. And what that really means is you do a cybersecurity risk assessment. You show what's called a threat model, where you consider the various vectors of potential attack to your device and potential vulnerabilities. You demonstrate what they call a vulnerability management program. That means, hey, if my software somehow has a component that gets deprecated, I have a plan to address that. It might not be that I patch it tomorrow, but I somehow assess that vulnerability. I make a conclusion, and that conclusion has some longevity to it. And another major area for consideration has to do with trusted communication. So most often there is no single endpoint for a device, right? It's often multiple endpoints communicating together to deliver care to someone. How do those endpoints communicate with each other securely, and making sure that it's more secure than saying I've ticked the box on Windows for encryption, and really understanding how cryptography feeds into that. And I think that's honestly one of the hardest things, right? Healthcare was designed to do healthcare. Most of us got into this space because we had some medical innovation that we really wanted to see come to market or were passionate about. It's a hard expectation to say, hey, I need you to be passionate about this clinical capability, and your second core competency should be cybersecurity. That's a hard thing to reconcile for a lot of folks in this space, and making sure that you lean on the right individuals for support will really make a difference in how your device architecture comes to life.
Right, right. No, that's really helpful. So kind of looking at a company as they start, and then we talked about, including cybersecurity into development, right? And then to get that into your submission to make sure you don't get rejected. But then past that, you're a company now in commercial distribution, right? And you have that software component, and you've done your job in development up to that point with thinking about cybersecurity. But let's talk a little bit about how to then stay on top of new threats, right? You hear things about, more computational power, and hackers just get more savvy by the day. How can a company that has, products in commercial distribution then keep staying on top of this increased threat over time?
Yeah, what they call this is the post-market vigilance, right? So the notion that once my device is out of my hands and it's in a hospital's network, do I still need to care about it as a device maker? And I think there's been a shift kind of in the universe of, historically, perhaps there was less diligence around that. And now the expectation from the FDA, as well as the consumers of devices, whether it's a hospital or a patient, they're all saying, look, we need your added support for the lifetime of this device. And lifetime of this device doesn't mean until you go on to the next gen. It means until this thing is truly end of life and out of the field. So I think there's multiple steps in there, right? I think the first step is really knowing what stages exist for product life cycles, and knowing when you truly do not need to be accountable for a device once it's out in the field is an important start. I think the next thing to think about has a lot to do with post-market vigilance in terms of vulnerability management. Those who have been watching the Change Healthcare, which is relatively recent right now, there's lots of vulnerabilities and exploitations that are actively occurring in the healthcare space. So being on top of having a vulnerability management program to watch the components of your software or your offering is equally important to maintaining your posture over time. And then the last thing I would really think about is understanding what security considerations your buyers have. So if I'm making a medical device, I need to understand what my hospital, my surgical output center, my patient in their house, what are the security expectations of them? Because sometimes we're finding that those expectations are actually more mature than what the regulator is asking for. And if you aren't aware of what those are, you can find yourself in a position where you're suddenly facing a 6-month sale delay because you're trying to work through security expectations that you didn't consider.
Oh, that's really interesting. I never thought about that. So basically, you might be past the FDA and you got their stamp of approval, but then you're at a hospital before the value analysis committee or something of that nature, and they look through and they say, hey, this is unacceptable. So that's basically what you're saying, that you can run into commercialization issues out in the field due to them having higher requirements for cybersecurity.
100%. And I will say the hospitals are actually really good about putting out their security expectations because they don't want anyone to be surprised, right? If you think about the numbers problem of this, as a device maker, I have a finite number of products out in the field. The hospitals have a many-to-many relationships. They not only have multiple device makers, they have multiple versions of the product in the field, and then they even have to track the thing across multiple locations. So that the number is just amplified significantly for a lot of these healthcare delivery organizations.
That's really insightful. No, this is great, Vidya. So for our audience that would like to learn more about this topic and also get in contact with you guys at MedCrypt and possibly get some assistance, do you have any recommendations for further reading or and also how to get in contact with you guys?
Yeah, absolutely. First things first, download the FDA guidance, pre and post market, print it out, put it on your fridge, and read every page because it is prescriptive enough that it will help you build a roadmap to success. I would also encourage you to check out our website. We have a Learn section where we break down the guidance. We have a ton of webinars that talk about recent trends, in particular around software bill of materials or deficiencies that we're seeing from the FDA's review process. And please, I would love to connect with folks. So don't hesitate to reach out either through the website or shoot me an email, vidya@medcrypt.com. One of the core reasons the company started is because we really wanted to see smart devices getting to the field, and being secure is core to that. So we would love to help and partner with other companies to find their way to success.
That's awesome. Well, I started off this session by saying that I'm excited because I was hoping to learn new things, which I certainly did. So thank you for educating me and our audience. And again, many thanks for joining QuickTalk today.
Thanks for having me.
If you enjoyed this episode of QuickTalk, hit like and subscribe. And for additional educational content, visit our website at quickvault.viva.com.